Of course, the topic of less than daily oral treatment is very important at the moment because so many countries have seen cuts in funding for HIV therapy. That, of course, has been a big theme of the conference. And so I think people have sensibly been looking at whether or not it's safe to take your oral antiretroviral therapy less than every day. We saw a cohort study presented yesterday. This was by Cassandra Fairhead, who works with Andrew Hill, which did show there was some safety of taking less than daily oral antiretroviral therapy with standard 3-drug regimens, but there was a mix of regimens within that. Some people were on dolutegravir-based regimens, but a lot of people were on efavirenz-based regimens, which we know have a long half-life. Efavirenz lasts longer in the body than dolutegravir. And then we saw a research study presented yesterday, Breather Plus, which was looking at young, mostly female population in Africa who were taking TLD either 5 days a week or 7 days a week. And in actual fact, that showed that the 5 days was inferior to taking treatment every day. So with TLD, which of course is a very popular regimen, particularly in low and middle income countries, some randomized controlled study data showing that actually if you took it 5 days rather than 7, there was a higher risk of virologic failure. Fortunately, not much resistance was seen in those people who did experience virologic failure, but nonetheless not so good in that particular trial. So an RCT with a very popular antiretroviral regimen, probably slightly stronger data than cohort data with a mixture of antiretroviral regimens. Well, the IMPALA trial was very exciting. This was presented by Fiona Cresswell. The IMPALA trial was looking at using injectable cabotegravir and rilpivirine in a group of people who had not been able to achieve virologic suppression on oral antiretroviral therapy. So they had viral loads of above 1,000 copies, and it was demonstrated in this trial that using injections was actually as effective as taking oral dolutegravir-based treatment, and there was some suggestion that injections might actually be better at achieving viral suppression in people who'd struggled with daily oral therapy. So really good data from IMPALA. I think this is impactful. We've been looking for data for some time that shows us that it's safe to use injections in people who cannot achieve virologic suppression on oral antiretroviral therapy, and I think the IMPALA trial is going to be discussed a lot in this consideration.
We also have preliminary results of long-acting PrEP monthly.
So this was data presented from MSD, from Merck, looking at a novel monthly tablet for pre-exposure prophylaxis, MK8527. I hope I've got the numbers correct for that one. This was an early study, so it was a safety study looking at different doses of this drug, and it was safe and well tolerated. They'll obviously be taking a dose, I think they're taking an 11 milligram dose forward in a larger clinical trial to look at efficacy, but the safety of this once monthly tablet so far looks good. We look forward to seeing data about efficacy in larger trials moving forward. We're seeing lots of discussion about the fact that people are having a good life expectancy with HIV, but we need to think about perhaps better ways to manage the comorbidities they might develop. Of course, we've seen a lot of discussion around cardiovascular disease since the Reprieve trial presented now 2 years ago. I think we've got better at managing lipids in people living with HIV, but there's been a good discussion here about whether or not we're managing hypertension, so high blood pressure, very well. I know in my own experience we probably are not managing hypertension as well as we do manage lipids. Of course, we have to think about other comorbidities. There's been a lot of discussion here about weight gain, potentially some good data showing that weight gain is likely to be associated with all the risk factors anyone experiences, not just people with HIV, and probably less of a signal around antiretroviral therapy. We've seen some discussion about specific aging services for people living with HIV, and I think it's really important to keep looking at novel ways to manage particularly metabolic toxicity, but other comorbidities people develop as they age, so that people living with HIV can have not only a long life, but also a healthy one with good health-related quality of life as well.